Happy Digital Health Week. We had a patient engagement forum, Michael mentioned it yesterday, and where we didn't have as many people in the room. We had our patient advisors, a great forum, but we used the hashtag Think Digital Health, and no pressure, but we trended nationally yesterday, so let's keep it up. So don't forget, Think Digital Health. So this is the first leadership session of the day, and pleased that it's, I think, very appropriate that it's a patient panel. And so what we're going to do is have an interactive discussion. We're going to use the catch box, and we're going to do some polling with you a little bit later as well. Michael mentioned the patients included designation, and it is important. It's very important. And I think even having the patients participating in the meeting, and what patients included means is they helped us plan the conference, participating on stage and attending. And that's really important. And I think it changes the dynamic of the conversation. So we're really looking forward to that. Thank you. I didn't plant that. So without further ado, let me introduce the panelists. And just you come on up, I was going to say ladies, but ladies and gentlemen, I want to call your name. So Jillianne Code, you've met already. She was asking the great questions already. She's an assistant professor of education at the University of Victoria. She holds a PhD in educational psychology from Simon Fraser University, a master and a bachelor of education from the University of Alberta, and a postdoctoral fellowship from Harvard. So very impressive. She's co-chair of the Oversight and Advisory Committee for Patient Voices Network, a patient partner on the Shared Care Committee, a member of the Steering Committee for Cardiac Services BC, and a public member of the Medical Services Commission. Welcome, Jillian. Our second patient panelist is Brian Penner. Brian Penner hails from Altona, Manitoba. Does anyone know where that is? Has it heard of Altona? Yeah, one, thank you. And it's about 60 miles south of Winnipeg. Brian and his wife Donna have 2 grown children and 3 grandchildren. He's been working in the insurance industry since 1987. He enjoys camping, fishing, and touring the country on his motorcycle. Brian and Donna are very active members of Patients for Patient Safety Canada. So very pleased to have you here. Thanks, Brian. And our last panelist is Sara Kearley. She's a realtor with Keller Williams Solid Rock Realty. She has a passion for working with people and representing their best interests in a transaction and will be willing to do what it takes to help families find their home. Sara believes in giving back. She's heavily involved with JDRF and the Canadian Diabetes Association, promoting awareness of type 1 diabetes. Some of you, her face might look familiar because Sara and her son Marcus were the face of our Better Health Together public education campaign, so she did some TV spots for us. She's written for the Huffington Post, the Yummy Mummy Club, The New Family, and has been interviewed by Ottawa Life and the Canadian Press. Thank you, Sara, for attending, and thank you for joining us. I do also want to call out, we had one other, and these folks were our patient advisors, and so they helped us, again, plan the committee and certainly fully participated yesterday and has been very engaged patients, as you can likely tell. I also want to acknowledge Annette McKinnon. She unfortunately couldn't be here today. She will be here tomorrow, but she was the other patient advisor that helped us plan the conference. So let's... Okay, I messed up already. All right, so this is some ambiance for us. We are going to do a bit of a fireside chat. So for those of you who attended yesterday and you heard Michael talk a little bit about some of our survey results, we interview and do surveys of Canadians every year on an annual tracking survey that we do to find out what their attitudes and perceptions are about electronic health records. For the discussion for today, for this session, we now did a little bit, another survey, about 1,000 Canadians 2 weeks ago, last month. And so we're going to be sharing those results with you. And what we're going to do is ask the panelists to sort of give us their impressions. And then we've got some online polling that we'll be asking you to do as well. So before I start that, just because if you're like me, it's not quiz time, I changed the slides, so sorry, Christina. So this is, if you haven't already, you'll need some time to prep for this, or if I were you, never mind. Mobile app, if you haven't already downloaded it, now's the time to do it. You'll see there's a polling and feedback session down in the lower left-hand corner of the screen, and so you get that ready for some of the polling questions we're going to have later. So that's what we're going to do, and that's the process. And panelists, I think that's what we've all agreed to, and so let's get started. What we did was when we did ask the survey results, we put them into these 3 categories. So we asked about the Canadian healthcare experience, we asked about what Canadians think about digital health, and we asked about connecting to care. So we'll have those sort of 3 categories. But before I get to that question, maybe I'm going to ask you, we've had this conversation about your patients' voices, patients for patient safety. Todd made the great comment about resources, and I agree that doesn't jive. We have a consumer health stream tomorrow that I want to sort of advocate and put your mind to that as well. So what do you think? Is it patients? Is it citizens? Is it Canadians? Is it consumers? Is it clients? Do you have any sort of preference, or have you talked about that at the committees that you sit in?
Not really. For me, I prefer people.
People?
We're all people. Everyone is a patient any time in their life. You never know when you'll be a full patient. You could, walk outside, get hit by a car, and then all of a sudden you're a patient, but you're still a person. So we're all people.
Yeah.
I find.
Yeah. Absolutely. The idea, sorry, I'm going to go university professor on you for a second. The whole idea of the patient, the word patient is actually the opposite of agent. And so if you think of somebody who is an agent in their own life, making decisions for themselves, as soon as you enter the hospital, you become a patient. And just by the nature of that, you give up your agency. And so you give up your power. And so for me, even just in that, I don't think calling us patients is going to be appropriate moving forward. So thinking ourselves as complete agents, as people, as humans, is important, and language is important.
Interesting.
Absolutely.
Yeah.
My wife made a great comment to some physicians a while back, and she says, "We are people first, patients second." Mm-hmm. And it's so true. We're all people, and we have feelings and stuff like that. And when we become patients, we need to be respected, and we need to be treated as people when we meet our clinicians and have our issues. So I think that's my preference.
Interesting. Thanks for that insight. I think that's helpful just for this discussion that we're having. Sister Noella Kenny, some of you may know, she's a nun physician, and at the time she was the president of the IWK Children's Hospital in Halifax, and she's also an amateur, I don't know what they call them, but somebody who's interested in words, and she said the nature of the word patient is pathos, is the root, and it means pity, but her argument that was that in the 80s when the trend was to call people customers or clients, and she said when patients come into the hospital, they are vulnerable, they are sick, and so they're not necessarily equal. But it's interesting that as you talk, there are times when you are vulnerable and you have to be treated that way, but others when you're in these kinds of settings, you're people first. I love that. All right.
Can I make one comment?
Yeah, sure.
I'd rather be treated with empathy than with pity.
Yes, absolutely. And I love that word, empathy. It's different from sympathy, and very different. Yeah. Okay, so let's get started. The Canadian healthcare experience. We didn't interview people globally, but we did look at a poll that Ipsos Reid published around globally what people say the top 3 concerns are for them, and what do they worry most about. Now, Canada, when I tell you what the top worries are, you won't be surprised that we are well below the global average for some of these numbers. And so can you think of what the top 3 worries are? I'm going to stand up because I feel like I'm not missing folks. So globally, the top 3 issues that the world is worried about is financial political corruption, number 1. 33% of the people in the world are worried about financial political corruption. And I think maybe that can explain, no, nothing can explain the results of the recent election. Number 2 concern, crime and violence. 30% of the world is worried about crime and violence, 16% of people in Canada. And the third one is terrorism. 21% globally are worried about terrorism in Canada. We're not that worried about it, 10%. So we asked Canadians, what are they worried about? The top 3 worries of Canadians. Throw out some guesses. I won't throw the catch box at you. Is healthcare in it? Yes or no? Yes. Number 2. What's number 1? The economy? I got to look. I don't remember now. Unemployment. So unemployment number 1, healthcare number 2, and taxes was number 3. So that was kind of interesting. And all of these things were higher than the global average for all of these things. So when thinking about healthcare, 61% of Canadians are concerned about Canada's healthcare system. It's interesting. And the top 3 reasons they're concerned, they think there's not enough providers, or there are long wait times, no timely access to home care or long-term care facilities. They tell us that the cost is not sustainability. They're worried about the sustainability of the future, and difficult to reach or communicate with health providers. So maybe I'll just turn it over to the panelists. What's your reaction to that? Does that resonate with what your thoughts or what you hear from your colleagues?
I agree. I think so too, because a lot of times the patients, when they want to see a provider, they're putting on a waiting list. Either you're sitting on the phone waiting for 10, 15 minutes to speak to the receptionist because, well, can you hold please? Right. And then the next thing is, oh, well, you have a pain today or you have a problem today? Well, the doctor has time to see you in about 3 weeks' time. Yeah. Well, it's a problem, and we need to make changes there. Communication. It's hard for people to communicate with their physician when you call the reception desk and they say, sorry, you can't speak to him. Well, it creates a problem.
Mm-hmm. Yeah. Sara?
Honestly, with the way that we deal with our boys and going with clinics, it's not that bad because they see them every 3 months. So it's usually when we leave that we pre-book for the next time. But with trying to coordinate the summer schedule of the clinic and our summer vacations, when the boys are done, like that summer is the worst time, trying to find when can they be seen by their doctor to make sure that their A1C is good or not good. And of course, we try to schedule it right around the end of June, the end of the school year, just in case. So then they have the free reign over the summer. But we don't usually have that much of an issue. But when it comes to family physicians, I haven't seen mine in 10 years. No. So.
Yeah. Absolutely. I think access is definitely one of the biggest challenges. I myself, I already told you all that I had a heart transplant, so naturally I had pretty quick and easy access because of the acute state of my condition and in heart failure. But the Heart and Stroke Foundation actually released a report early this year on the number of people in Canada living with heart failure, and it's over 600,000 people in Canada live with heart failure, but only 15% of those actually have access to specialized heart failure care. So that leaves 85% of Canadians who are in heart failure without proper access to that specialized care. So there's a real problem and there's a real challenge that we need to figure out. And a lot of my friends, patient friends, have this very issue.
Yeah. So we're going to have a chance, I hope, for lots of discussion. So if you've got stories or things, and I think one of the panelists said, like, we all have experiences, we all are in the system, or know people in the system, or will be in the system, or have been in the system. What we're going to do now is maybe just get you to know, I think through some of the comments, you can guess what sort of in what capacity our panelists are patients, but maybe have them talk a little bit about their personal story. So we're going to talk about Jillian first, and we asked every of them to send us a photo, and this is the photo she sent, which I thought was amazing. So Jillian, do you want to tell us a little bit about you and about this photo?
I'm going to stand.
Sure.
Yes, as you can imagine, I've had quite a challenging journey. Some
like showing
good.
a picture of your chest. Woohoo!
Yeah, well, I am, actually. This is me, or it was me, about 2 years ago, a little over 2 years ago. And what you see here is an internal cardioverter defibrillator up in the top corner, and you see an LVAD. And an LVAD is a left ventricular assist device, and basically what that is an artificial heart. And so I was in quite a bit of trouble. So that's me in all my glory, in all my digital glory. And a master of technology, to be sure. I had to write a few notes down because I'm no longer able to just often talk off the top of my head, and especially when I'm talking about my story, it's sometimes challenging. So I'm just going to kind of read a little bit from something that I've prepared. So I stand up here in earnest, really thinking about how can I possibly tell you all of the details of my story, and how can I tell you about, for most of my adult life, I suffered. How heart failure literally squeezed the life out of my body, and how I struggled to breathe with what felt like a vice around my chest. That despite a stroke, multiple ICD shocks, a left ventricular assist device, severe GI bleeding, countless transfusions, 13 months on the transplant list, a heart transplant, 8 days in a coma with multi-organ failure, delirium, and having to learn to feed myself and walk again, that I refused to die, and I still refuse to die. So I stand here before you today, 768 days past the time when my natural life ended. And there isn't a day that goes by that I don't think about my donor family. And when I do, I always stop and I place a hand over my chest and I close my eyes and I breathe in and I send out a prayer of gratitude. Because I am humbled and I am grateful to all the effort it has taken to keep me alive, to my vast team of doctors, nurses, and allied professionals. And I am strengthened by the presence of so many, because I know that my life and my transplant and the events leading up to it continues to be an experience shared well beyond my own. And so many of these people have enabled me to live my life without focusing on what this disease has done to me. And to give you an idea of just how many people that is, for my heart transplant surgery alone, that's over 100 people. It takes over 100 people to coordinate a heart transplant. And so in the 2 years since my transplant, my gift has helped me live boldly and earnestly. And it has enabled me to have dreams and empowered me to follow them. So you think, why am I here? I can't help but think of all of these people. And I'm duty bound, I feel. I'm duty bound by honor to be here. And so they've helped me find my passion with a new purpose and a new line of research and a new voice by patients and for patients through the establishment of the HeartLife Foundation, which is Canada's first and only national patient-led heart failure organization, working together to elevate our collective voice. And by collective voices, I mean patients and family members, of course, but also the clinicians, nurses, and industry partners who have made it possible for me to be alive. Industry partners. See the hardware in my chest? That's innovation that I wouldn't be alive without. So like I said, why am I here? Because I need to be. I have to be, and I'm bound by honor to be here. Because I can see clearly now that I have a very powerful knowing, and I say this all the time, that I am more me now with someone else's heart than I've ever been. And that like it was meant to be, that it would take two people to fulfill a purpose that neither one of us was aware of. Thanks.
Brian, sorry, go ahead. Go ahead.
Me? Yeah, there we go. There's a picture of my wife and I. About 8.5 years ago, my wife had to have a laparoscopy. In order to get a laparoscopy, you also have to have a paralytic. So your body is totally paralyzed when they do the laparoscopy. She was given a general anesthetic to put her to sleep, and then given the paralytic to keep her from moving. A few minutes later, she woke up from her surgery thinking it was all over. She felt them scrubbing her abdomen. And then she was horrified by the surgeon's words of "scalpel, please." She was terrified what she heard. She was paralyzed and couldn't let the physician know that she was awake. She felt every incision. She felt the instruments being pushed inside her. She heard all the comments that were made in the operating room. She was awake during the surgery. Some of you may know Dr. Brian Goldman. He interviewed my wife in September and put it on his show, White Coat, Black Art, and it's called Awake During Surgery. So my wife is trying to get the word out, and it's working. After the surgery was over, she was moved into the recovery room, and she told me what happened, and I asked the nurse to get the anesthetist. She says, well, the anesthetist has left the hospital. I said, go get him, please. So he came back, stood about 5-6 feet away from my wife's bed. My wife began to tell him what she had gone through. She had felt and heard everything. She was awake during the surgery. And the anesthetist didn't even really look at her. When she was done, he shrugged his shoulders and said, it happens sometimes, and then left the recovery room. We were standing there, I was standing there, she was laying there. We were both in shock. We didn't know how to respond. 2 weeks later, she was diagnosed with severe post-traumatic stress, and she's had a lot of appointments because of it. Her first psychologist suggested to her, talk about it, talk about it, talk about it. He says, don't keep it bottled up inside, and talk about it, and so it doesn't explode on you. So, and that's what we've done. And she's felt that if she can save one person or stop one person from having what she's been through, she will tell her story 1,000 times. So since her surgery, we have been involved since 2010 with Patients for Patient Safety Canada. And in 2013 is where I started my relationship with Canada Health Infoway. And it's been good. It's been a very good experience. And for my wife, her stress relief is the motorcycle. Often I can come home from work, the garage door is open, and she says, I need to go for a ride. So that's what brought us to this Canada Health Infoway.
Okay, so I guess it's my turn. So I'm Sara. My son, Marcus, is the one that's sitting on the ladder in the orange shirt. He was diagnosed with type 1 diabetes September 2011. Sorry, I'm going to get a little emotional, so if anybody has a napkin or a tissue or something, I totally came unprepared. So when he was diagnosed with type 1 diabetes, I thought our world was over. Thank you very much. It became suddenly a world of finger sticks and blood sugars and making sure that he was eating enough or eating properly and eating often. And the way that our life was, I just got rid of the diaper bag. We got to leave the house and not have to carry anything. And all of a sudden we had to carry this bag of insulin and test strips and lancing devices and load treatments and extra insulin just in case, the one vial breaks and we'd be out of luck. So we've done that for 5 years now. And then 3.5 years ago, my stepson, Calix, who's the one that's above me in the red plaid, he was diagnosed with type 1 diabetes as well. They're not blood related, but we just happen to be in the same household. And then my husband, Tyson, he's actually a really wonderful man. He's really, really great. Sorry. I've had conversations with other moms who have type 1 diabetic kids, and they feel that they can't leave the house, they can't have a moment of silence or a piece of time to themselves to go see a movie or do anything because they don't trust their husband to know everything on how to make the adjustments of, okay, well, he's 25, what the heck do I do? They don't know, how much insulin, they don't know their carb ratios, they don't know how to bring their child down from that. And my husband, when I met him, when Marcus was the only one, he jumped in, he's like, I want to learn everything. He's like, I want to be able to give you time to yourself. So luckily, he knows how to handle everything. And my daughter, Larkin, she's 2.5 now, but we did the type 1 diabetes trial and that test with her, and she came back positive. So she's possibly going to develop type 1 diabetes, sometime in her life. But myself and my husband and even my ex-husband, Powell, we've all done the type 1 diabetes trial net, and we all came back negative. So we were really shocked about this. So with Marcus, when he was diagnosed, I didn't know what to do, so I felt like I was going to explode. I went online, I tried to research everything I could. I found Twitter, and I started tweeting with people in the States and the diabetes online community, which is an amazing support group for anybody. They have weekly Twitter chats, and I was like, I got into that. And then I started blogging, and then just to release and see, it was like, I'm not the only person. I can't be the only person that feels trapped by a disease. And Canada Health Infoway reached out, and Marcus and I were put on national television, on a television commercial, and Marcus still loves that. He still has the shirt that it's way too small for him. He's like, but they bought it for me. But it's like I try to advocate everywhere we can that even though you have a life-changing illness, it doesn't change who you are or what you do. It's all about having a voice, and you need to be involved. Even if you're a parent of a young child with a disease, you need to be involved in their care, and they need to know that they can speak up for their own care. Because if it doesn't work for them, the doctor doesn't know. Like mentioned before, it's like they need to come into your life. They need to see what's going on with you and how you guys live to know how to be able to better treat us. Because like Marcus is active, he plays soccer 3 times a week. Calix, he prefers to sit and play video games. Their diabetes management is completely different. But when I hear stories like Jillianne where innovation has saved her life, and then there's also the innovation where it's not so nice, where it almost killed Brian's wife, where she could feel everything, that it makes me happy and then makes me angry. And there's so many things that could be done to protect ourselves, but we need to stand up for ourselves and speak for ourselves as patients. But I'm here because of my kids.
This is why we need patients in the room, because we talk about patient, but you all have stories that are very different. I hope I won't need Kleenex, but you know me. Okay, so let's move on. When we ask patients about their care, and we have very engaged patients and active patients for very specific reasons sitting here. The survey went out to 18 plus. 64% said they were involved in their care, and 72% felt confident in being active members of their care. Look at the numbers when we get to that 65 plus. More are involved and more feel active in patients of their care. Now, we have these conversations all the time, and when we talk about activated patients and engaged patients, one of the comments and questions we always get is, well, elderly patients, they're not comfortable with computers, and they don't have the capacity to be involved and confident in their care. That's not right. Look at these numbers. I think the numbers are very good. And I think that's important to know. And I think I want to get to I'm mindful of time, but I want to get to that. And maybe we can talk about that in terms of, how do you get patients more involved in their care? You're obviously engaged patients. You've obviously, for the reasons why you've highlighted so eloquently why. How would you think, maybe, Jillianne, I'll start with you sort of as a professor. How would you grade our health system in terms of its ability to engage and listen to patients? And, maybe do you have any hope? Or I'm assuming it's going to be not a great score, but anyway, let's hear from you.
Well, first of all, there's always hope.
Yes, there is.
There's always hope. In terms of how we engage patients, I'd probably give it a D. I wouldn't give it a failing grade because there's pockets of awesomeness, of really great patient ways that people are trying to engage patients. But in terms of, we think about how do I engage my students? I get students talking to each other, right? So, when everybody was most engaged is when you were throwing that thing around. Some people are stood by and say, "Oh, not me."
Lots, actually.
But for the ones that got hit by it, that's me with the illness, right? So the box is the illness and it hits me. And that's just the way things happen sometimes. And in terms of getting students involved, we get them working together and talking with each other, and that there's a natural extension to that to become motivated and to want to and just want to be better at what you're doing. And the same concept, we're humans, so education, flip that into healthcare, where the stakes are much higher. Get patients talking to each other. And for me, that's what happened, is when I first, because I was diagnosed with heart failure at 28. And I'm sure many of you think, how is that possible? I ask myself that all the time, but it was a viral infection, they suspect. But when we think of heart failure, we usually think of all the old people in the old folks' home, and which is actually a false statement. But once I started connecting with other patients that were like me, and I understood that I wasn't alone, that's when we started to learn from each other, and people at different stages of the disease can start saying, well, you know what, this is what helped me, and what helped me was this. I'm talking to here's some things to ask your doctor next time. You don't know that information? Well, call them and ask, and et cetera, et cetera, et cetera. And that was mostly mediated by social media, right? So in my case, it was Facebook, but that was kind of, it's the gateway drug. But it helps, right? Because if you Google heart failure and you come up with all these really devastating studies that they say you have a 10% chance of living the first year and all this kind of stuff, and at 28, right? Absolute panic sets in. Okay. So.
Facebook is the gateway drug. That's going to be the most tweeted phrase, I think, in here. That beats that Leonard Kish quote around the blockbuster drug of the 20th century. I'm going to just move on because I do want to, I know there'll be lots of questions, and I want to make sure that we get through all the ones that we have here. So the next phase, as I talked about, we had 3 phases of the survey. What Canadians think about digital health? So now it's quiz time. So by now you've uploaded the mobile app and you're ready to go. Just a reminder, the polls and feedback loop is at that bottom right-hand corner. And so we asked in our poll Canadians to indicate their impression of the progress of digital health in Canada. So the 3 multiple choice are: they believe digital health is fully implemented, they believe it's somewhat implemented, or there's little or no progress. So I think what we're going to do is we want you to answer that poll. And so you should be able to download it and answer the question. And then what we'll do is we'll compare your answers to the answers that Canadians gave us on our survey. And then we'll ask the panelists to sort of respond and think. So panelists as well. Oh, look at that. So the middle one, just to refresh your memory, they believe it's somewhat implemented. So that's this is what our audience are polling. So we don't have percentages on that. Oh, they do. So 12%, 67%, 21%. 12%, 67%, 21%. Here's what Canadians told us. 28, 25, 48. We were 12, 67, 20. We're not the same. That's interesting. Reaction, comment?
Well, I think across Canada, the percentage may be higher that people believe digital health is somewhat implemented. In southern Manitoba, we would be more in the 48 percentile because we're moved from Winnipeg, an hour south. So therefore, a lot of the people in our area aren't sure what digital health even is because we're removed from Winnipeg. But we've had situations where my sister-in-law has been able to contact her specialist in Winnipeg via email, and my father-in-law was able to talk to his oncologist via telehealth as his health was diminishing. So we are getting there, but we're just not there yet.
Right. Sarah, Jillian, any reaction?
I actually think that it's more so that people don't feel like they have a need right now, as right now they may not have a current chronic condition, they may not have to see anybody, they may not have to like email doctors or have contact with them. So with the somewhat implemented, I think that maybe it's that they don't feel like they have a need right now, so they don't really know. You know, that's, or I mean, like the little to no progress. They might not have the need, so they don't know. And that to me is where probably the 48% is really from, is the people who don't have a need.
Interesting that the differential between the folks in this room who are, working on this stuff and sort of the general population. We're going to come back to that because we've got another question. Just again, this is an interesting telling, and Michael hit on this comment earlier. 90% of Canadians want digital health, and they want these things: book appointments online, renew prescriptions online, e-visit their clinicians, et cetera. So we have doubled those numbers, 20 to, depending on which figure there. So we've got 17 to 22% of Canadians can actually do these things. So there is still quite a gap. So what's holding back progress was the second question. So if you think there's been no progress or little progress, why isn't there progress? And so these are the reasons why that's stated. They don't know that these tools are available. So Canadians don't know these tools are available. That's what Canadians are saying. They believe it's not a priority for the government. The third reason why they say there's no progress is because it costs too much to make them available. And I'm sorry, there's a typo there. I see it. I know everyone else who sees it, who's a teacher, is going to say that. Healthcare providers are not interested in providing them to patients. So those are the top reasons why people say there has been little or no or somewhat advancement. So Canadians, then we asked them, like, what would make you more engaged and empowered? And so these are the top three reasons. I would be more engaged and empowered if I had online access to my health information. I would be more engaged and empowered if my doctor treated me as a partner. I'd be more engaged and empowered if digital health tools were available to help me track my health information. Comments, questions? I mean, I think you're all using those tools and you're living examples. When you talk to your friends and neighbors who are not in the system or are not active patients, as it were, do you get a sense of that these, does it resonate with you in terms of they're not aware, they don't know, or they don't care, or they don't know what tools are available and exist?
Well, especially in the Altona area, southern Manitoba, a lot of our more mature people are too scared to ask the doctor. The doctor says, here, this is what you need, this is what you gotta have. The patients don't ask any further questions. Mm-hmm. And we've talked to our parents, we've talked to our aunts and uncles, and we've said, you need to ask more questions and get the doctors to tell you your options and give you advice that you can make an educated decision.
Mm-hmm. Interesting. Yeah. So do you see an age difference?
Oh, absolutely. It seems like as soon as you get 70 plus is when the real barrier breaks down, where the people just say, well, doctor says this is what I have to do. And, well, why? I don't know. He just said I have to do this. They don't get engaged. They don't find out why.
Doctor is the king. Yeah. Just raise of hands. And does that sort of resonate with people? People feel that? I mean, my mother is the doctor, and I don't ask questions of the doctor. I don't want to waste his valuable time. Yeah. Yeah. Same experience?
That's what I've had. Well, with the boys, because like I'm not the patient. I'm their caregiver, and because they're under 18. But like in my generation, like my friends and like my other colleagues and stuff, we're not really the age of major chronic illnesses that a lot of them don't need it. But like my parents' age, just like doctor knows best. Doctor told me to do this. I'm not going to question it. They know what's best for me. They know that it doesn't interact with this medication. I'm like, they may not know if you went to another specialist that you're on that medication. Right. So like we have to be advocates for ourselves always.
Well, I think that I think it really is about not knowing what's available. And I mean, why would you care about access to your blood test results if you never have to get blood test results, and you're not, you're otherwise healthy? I was misdiagnosed at first, right? And so I was of the same mind. Well, my family doctor sent me back, I went through 3 rounds of antibiotics before, and 2 trips to the emergency room, and it was fun. And, and so once I learned, I had to learn not to trust my doctors, and only because they only see a snapshot of time, and learning that lesson before I could become empowered then, and by accessing Dr. Google and Dr. Medline and all of these things, because I am a researcher, and learning to ask those questions and do all of those things, did I learn to then trust my team, right? And they did become my team, and I became a partner in my team because of that dialogue. And so until you have an experience, and then you realize what isn't available. And at the time, my blood tests weren't available online, but now they are. Or I actually have to go to specific labs in order to get them online. So I go to those specific labs so I can get that information, so that, and it comes back like within the same day, and I look at it and I'm like, I'm good. And then 2 days later I get a call. They're like, you're good. I'm like, I know. Yeah. I know. Thanks for calling. Yeah. Right?
That's a great example. Yeah. I had to learn not to trust my my doctor. That's an interesting twittable thing as well. Okay, we're going to put you to work again. Another poll. So we asked Canadians, based on their current experience, to what extent digital health services make a difference or have an impact on their quality of care. So there are the choices there. It's making a significant difference, it's making a bit of it some difference, and it's making no difference at all. So again, we'll do the same drill. You know the drill. We'll ask you to respond to that using the poll survey results. There they are coming up as we speak. So again, the numbers were a significant difference, some difference. This is a bit of a middle of a packed, typical Canadian crowd. I'll take the middle one. 12, 58, and 30. 12, 60, and 30. All right, so that's 12, 68, and 30. Remember those numbers. Here's what the actual poll results, 30, 20, 42. Isn't that interesting? So in the first one, we grossly overestimated the amount of progress that we thought Canadians thought. And when we asked Canadians if they think we're making a difference, we underestimated that we were making a significant difference. More Canadians think we're making a significant difference than we think. Good on us, maybe. Maybe that's just being humble, or maybe that's we're getting the word out. So reaction?
I'm really surprised by the 42 where it's making no difference or impact, because to me, that made all the difference for being able to have the access to email to get things uploaded for Marcus's blood sugars, or trying to get his numbers changed so we have the right numbers going in his pump to give him the right amount of insulin. Like, to me, I'm really surprised that people feel like it's not making any difference.
And yet for me, it doesn't surprise me at all, the 42%, because I asked a couple people in our church the other day, or I told them I was coming to a digital health conference, and the people in our church says, what's digital health?
No! Good thing you were there, Brian.
And I said, excuse me? So I had to explain. And then they said, oh, I didn't know. I guess they didn't know the terminology digital health. It just caught them off guard. But that's why in our southern part of Manitoba, I can see where 42% would say it's not making a difference.
I wonder, in the survey, was digital health defined?
We usually define it? Yes.
Okay. So you said everything from like accessing Google. Okay.
The whole gamut. Yeah.
Good one. Good one, Infoway.
We've done this before.
Because that would actually make a big difference, but.
But it's interesting because when we first started doing our annual tracking surveys, we were asking about, remember this was 10 or 15 years ago, we were asking about electronic health records. And then it was only in the last few years we've actually switched the vocabulary and the narrative to digital health, because electronic health records are pretty narrow, and now digital health, I mean, it's the apps, it's the Dr. Googles, it's those things. and the electronic health records and the EMRs and all those other, and the patient portal. So we've deliberately expanded that, but we haven't been using that term for that long. So and that's interesting, and maybe people in the audience have some thoughts around that. And while I'm here, let me throw out something else. We're talking about virtual care, connected care. Every time we throw out sort of what do we call this? We get people saying, no, that's not right, it's too narrow, it's too broad. So if you have any ideas or thoughts about that, be interested to hear them as well in terms of, because it really makes a difference. I was at a session at Harvard, an OECD session, and one of the folks from NHS, they have this certification of some of their apps, and they had done focus groups, and on the surveys it said, if it said it's certified by NHS, approved by NHS, accredited by NHS, people had different levels and sometimes marked different impressions about whether that was a good thing or a bad thing. So the words you use make a difference. So interesting comments. Okay, this is where I'm going to stop for questions, but I'm not. I'm going to go on. We've got one more slide, and then we've got some time for questions. So I think I'll do it that way. If you indulge me as moderator, I'm going to do that. The last section of those surveys we talked about again was that connected care, patients as partners. And so here's the vision statement that we're sort of throwing out there. We used this yesterday. It's 2020. All Canadians are using digital health to actively manage their health. Pipe dream or impossibility? What do you think? Sara, maybe I'll start with you. Can we get there?
We can definitely get there, but as in your group first thing yesterday, but we want it now. We don't want to wait for another 4 years, and we don't want to end up putting it off, and then it'll become, the 2030 goal or 2040. It's 2016. We have access to all this information, all this technology, and I know that there's policy and everything all surrounding everything. But there's no reason why we shouldn't be able to get to it sooner.
Absolutely, we can. If we really want to, we can get there. But we've got to get the patients, we've got to get the providers, and we've got to get the government all to be working together, not separate. If we work together, absolutely we can get there.
Ditto. Absolutely. Couldn't have said it better.
People-powered health.
Yeah.
That's what we talked about yesterday. I think there's no question when we talk about engaging patients, this panel clearly underscores why it's so important, and knowing that we're all engaged patients, and we should all be engaged patients, and very encouraging that, and don't let the status quo just because we couldn't last time. So I hope that you will thank me very much and join me in thanking our panels, Sara, Brian, and Jillian. Thank you so much.